Welcome to Pharmacy Tech Mastery. In today's lesson, we're diving into one of the most important skills every pharmacy technician needs: dosage calculations. Don't worry, we'll keep it simple, practical, and even a little fun. Whether you're working in retail, hospital, or compounding pharmacy, getting the right dose can literally mean the difference between safe and dangerous care. It's your job to calculate with confidence. The core formula we'll use is simple: dose, milligrams equals weight, kilograms times milligrams per kilogram. Volume, milliliters equals dose divided by concentration. Let's break that down with an example. Say you're helping fill a prescription for a child who weighs 22 pounds and needs 10 milligrams per kilogram of acetaminophen. Step 1. Convert to kilograms. 22 divided by 2.2 equals 10 kilograms. Step 2. Multiply. 10 kilograms times 10 milligrams equals 100 milligram dose. Step 3. Liquid is stocked as 100 milligrams per 5 milliliters. So 100 divided by 160 divided by 5 equals 3.1 milliliters. That's the volume you'd measure. Here are 3 quick tips to avoid dosage drama. Always convert pounds to kilograms. Label every unit in your setup. Don't skip steps. Use dimensional analysis to catch mistakes. Quick quiz: a patient weighs 60 kilograms and needs 15 milligrams per kilogram of a medication. What's the total dose in milligrams? That's right, 900 milligrams. You'll use these types of calculations every day, from fourth prep to pediatric dosing. And the more you practice, the more confident you'll be.